125 ovarian cancer, PSA in the prostate cancer or prostate inflammation, CAA in the GIT disease or GIT cancer. Also, there is another question that is common in all interviews. What is GTT? GGT is abbreviation for glucose tolerance test. It is a medical test in which glucose is given or introduced and blood sample is taken to determine how quickly the glucose is cleared from the blood of the patient. Okay, and there is guide before doing this test, which is restrict carbohydrate intake before 3 days of the test, and on the day of the test the patient is come to our laboratory fasting, so I can give him 75 grams of oral dose of glucose in water. For pregnant woman, I can just give her 50 grams of glucose. Okay, this is for diagnosis of gestational diabetes mellitus. And the sample must be taken, urine sample and blood sample, and also there is 1 hour sample and 2 hour sample. Okay, the normal result of the GTT must be the fasting is less than or equal to 110 milligram per deciliter, and the 1 hour must be lower than or equal to 180 milligram per deciliter, and the 2 hour must be lower than or less or equal to 140. And there is curved for the GTT. It has many curved shapes. There is normal curved. This is what I'm telling you about now. The normal values for fasting 1 hour and 2 hour. The highest values do not exceed the renal threshold. There is no glucose or ketones in the urine. This is called normal fasting blood glucose level in the GTT. There is diabetic curve, which fasting is over 110, and there is urine glucose. There is glucose urea. And there is renal glucose urea curve, in which there is the urine glucose, which appear there is glucose urea, while blood glucose is less than renal threshold. Okay, this occur in renal disease or renal problems. And there is curve called the lag curve. There is rapid absorption of glucose. Okay, the fasting blood glucose is normal, and it rises rapidly until it exceeds the renal threshold. This happens in the gastroenterostectomy and in the thyroiditis, hypothyroidism, and in pregnancy. Rapid absorption of glucose occur, and it is called lag curve. Also, there is related question in the diabetes mellitus. The fasting blood glucose must bigger than or equal to 126 milligram per deciliter. Okay, and the plasma glucose random is over than 200 milligram per deciliter, and hemoglobin A1C is over than or equal to 6.5. Okay, there is situation called impaired fasting glucose. It is must be over or equal 110 and lower than or equal 126. This is called impaired fasting glucose. And there is also impaired glucose tolerance. It is lower than or equal for 140 and it must be lower than or equal to 200 and over 140. Also, you can be asked about the steps of our laboratory testing, which had 3 phases: the pre-analytical phase, the analytical phase, and the post-analytical phase. In the pre-analytical phase, this is about receiving the sample. So there is something called rejection criteria. Rejection criteria type 1 and rejection criteria type 2. So I can reject the specimen if there is any problems about it, the volume, its color, if there is hemolysis, if there is lipemia, and etc. And in the analytical phase, this is when you receive the specimen until finish the processing. So you shouldn't never receive any sample if control is out of range. As I said in the quality control running, if the quality control results are out of range, never ever receive any specimen. And in the post-analytical phase, there is 3 steps, which is verification, correlation, and reporting. In the verification, we have to verify if the results given by an instrument is correct or not, to be sure that there is no erroneous report. Okay, and the correlation, to correlate laboratory findings to the clinical findings of the patient, matching to the patient condition. If matching, release the report. Not matching, contact treating physician. Doctor, there is unexplained laboratory result and you have to ask him about it. Then make documentation, and you have to discuss with the doctor if he is agreed to release the result or not. So the doctor, he can say, yes, I expect this result, or he can say, no, I didn't expect this result, so would you recorrect the sample again? So you have to make recollection and run the sample once time again. And if all these are fine and there is good correlation and there good verification, so you can make reporting of patient result, dispatch of the result to the patient. There is also question about maintenance. What is maintenance? You can say, or why do we make maintenance in our laboratory? So you can say, the purpose of maintenance to keep our instrument in its optimal condition, and it has to be scheduled by the manufacturer, as I said, daily, monthly, weekly, bi-weekly, or etc., according to the manufacturer recommendation. As I said, the daily maintenance by using flushing or cycling of cleaning solution, so we can remove the protein debris in the instrument. And the monthly maintenance can be used by carryover. I will tell you about carryover later. You may also ask about precision. What is precision? Or accuracy. What is accuracy? You can say the accuracy is difference between result and the true value, and it is description of systematic error, and it is measure of statistical bias. And the precision is degree to which the measurement and under unchanged conditions show the same results, either by replicate analysis or duplicate analysis, related to reproducibility and repeatability. You may also ask about validation or verification. As I said, as I know, validation must be done by the manufacturer to make sure that this instrument is valid for doing those tests, and verification must be done in the laboratory when we buy new instruments, so we have to verify it by doing quality control, by doing precision, accuracy, and etc. And also they may ask you about the chemistry safety or the general lab safety. As I remember, sometime in the interview they asked me about the chemistry safety, so I remember I said to him I can use the biochemical safety cabinet or the PPE, personal protective equipment, like lab coat, gloves, eye mask, face mask, eyeglasses, and etc. Also, there must be eye wash station in the laboratory for eye accidents, and also there may be fume hoods to collect all bad vapors and send it out to the laboratory. And I remember they sometimes ask me if there is any sealing stick, what to do. I said to him, number one, never ever do not press the stick position, because by that way we can introduce more bacteria or contaminants into our body, just wash it by running tap water as an example. And we have to notify the lab supervisor or lab director, and we have to document what happened. Okay, this is policies for it. And we can make scanning for all samples in that day for hepatitis B, C, and HIV. Okay, as I remember. And they ask me sometime if there is chemical poured in the bench, what to do. We have to absorb it with absorbent material like cotton as an example, and in the material safety data sheet we can follow the steps for that risk. Also, there is acid urine crystals and alkaline urine crystals they may ask you about. And the acid urine crystals are calcium oxalate, uric acid, cysteine, cholesterol, tyrosine, leucine, sulfonamide, and amorphous urate. And the alkaline uric crystals are calcium carbonate, ammonium biurate, triple phosphate, and amorphous phosphate. Also, there is a familiar question or cases in hematology. If there is a sample with low hemoglobin, we have to do which test? This is, I think, easy question. So we have to make retics count, because when retics are high, the hemoglobin will be low. And what is suspected value of critical hemoglobin? As I said before, it is more than 20 gram per deciliter or less than 4 gram per deciliter. Also, there is the formula for corrected calcium. When there is hypo or hypalbuminemia, the calcium must be not corrected. So the formula for corrected calcium is serum calcium plus 0.8 multiplied by 4 minus albumin. Again, serum calcium plus 0.8 multiplied by 4 minus albumin. And there is also formula for LDL cholesterol. It's equal to total cholesterol minus HDL minus triglyceride over 5. Again, total cholesterol minus HDL minus triglyceride over 5. Also, they may ask you about blood grouping, direct and indirect blood grouping. So indirect blood grouping, we use the patient cells and the antiserum. It is commercially prepared antiserum. And the indirect blood grouping, we can use the patient antibodies or patient serums plus commercially prepared cells. This is for direct and indirect blood grouping. There is a lot of question. I can say it without answering. I can answer it later on, okay? They may ask you about what film, and how can you make the blood film, or about staining of the blood film. And there is case, if there is platelets low, what to do. In case of platelet low, we have to check it under microscope. There may be it is really low, or if it is normal, we have to check the anticoagulant, because EDTA make platelets to trigger to other, so we can use another anticoagulant, which is sodium citrate. Also, in case of prolonged PT or PTT, what to do? They may ask you about PT and PTT, normal values of it, and if prolonged, what to do, and how can we differentiate between the prolongation of PT and PTT, and also which anticoagulant that may interfere with vitamin K. And its answer is warfarin therapy, okay, or warfarin anticoagulant. And which anticoagulant they may affect PT? Also, it is warfarin. It affect the common pathway. And there's question, if you find abnormal result in CBC, what to do, or what is corrective action? I think the first step is making a blood film and review it under microscope. And abnormality in RBCs, like or shapes of RBCs, different shapes of RBCs, you may also be asked about. As I said before, there is a question about TAT, turnaround time. It is time that start from receiving our specimen until releasing the result or report. And moderate, it must be 30 minutes. We have to be adherent to the or showing commitment to timing. If there is any delay, we have to explain why. This is turnaround time. Also, you may be asked about hemolyzed sample, and when do you have to reject the hemolyzed sample? The most important question is it is unacceptable for potassium, because potassium is intracellular, so we have to reject and ask for recollection. Also, you may be asked about lipemic sample. If you received a lipemic sample, what to do? In CBC, it increases MCV, MCH, and MCHC. In biochemistry, I think it will invalidate tests that done photometrically, because it will cause turbidity, especially in CK, CN, CKMP, creatinine cannot be reported, and we have to ask for recollection. Or we can just ask the doctor to request the patient to come on fasting status next day. As I said, you can ask about the abnormal result in CBC. You can say we can find increased WBCs or low WBCs, increased hemoglobin, low hemoglobin, decreased MCV, and RDW, increased RDW. There must be anisocytosis. Also, there is case in blood banking. He can ask you in cross matching, the patient sample is incompatible with all units. What to do? Okay, I can say I can make a screening for antibody and identification for the antibody. The examiner may say all of it are positive, so I can put in my mind the auto control. So I have to put in my mind the auto antibody. I can make correction either by elution or absorption. You can read about it. Elution, I think about just about changing the environment of the testing. If it is called antibody, I can make the test in the warm environment. If it is warm antibody, I can make it in room temperature like this, or using acid or alkaline substances. For absorption, I can put corresponding antigen, so can react with it, and it can disappear automatically. Also, you may be asked about KPI. What is KPI? It is abbreviation for Key Performance Indicator. It is tool, we can use it for quality improvement. The most common used KPI are TAT and critical result, the turnaround time and the critical result. And there is also important question about coagulation. In case you have prolonged PT, what is causes? It is extrinsic pathway, and there may be liver disease or factor 7 deficiency or DIC or warfarin therapy. This is most common. Warfarin is used for cardiac problems or coagulation problems. Also, they can ask you about, do you know anything about INR calculation? International normalized ratio. It is a test, a PT test in duplicate over control in duplicate, all this to the power of the ISI, International Sensitivity Index. And they can say why we can calculate the INR to minimize lab-to-lab variation. This is an important answer, to minimize lab-to-lab variation. Also, they can ask you about carryover. What do you know about carryover? And carryover is the type of maintenance procedure, especially in hematology, and it's transfer or contamination of low concentrated specimen from high concentrated specimen. So the aspiration probe can be contaminated from previous concentrated sample, and it may cause false elevated in the next sample. As part of our monthly maintenance, we check the maintenance of machine. So we check the machine for carryover. In the rack, we can put first tube filled with blood, and from second tube to the fifth tube, put diluent only, and run the machine. Then review the reading in the tube 2 to 5. If there is any reading, means that there is carryover, so we have to make recalibration for the instrument. Also, you may be asked about the types of quality control, assayed or non-assayed. Assayed that has non-value, non-assayed that has non-value, and it may be either homemade quality control materials. It's called pooled quality controls. We collect the serum of different patients during different days of the week and mix it together and measure certain parameters in it and put it as a quality control material, or as commercially prepared. We can buy a ready commercially prepared quality control material. You may ask about it. Also, you may ask about the reference range of different parameters, the important, like potassium, calcium, chloride, calcium, transferrin, phosphate, magnesium, protein, albumin, bilirubin, alert. So you have to pick some examples and review it. I think this is all question that I have just remember from my own interviews and my friends' interviews. And if I remember another question, so I will write it to you later, inshallah. So I will write down all these questions, but without answer. You have to put your own answer, and it can be accessible for you. So good luck and see you soon. 125